I had a rupture around 24 weeks, a massive hemorrhage. On my way to the hospital, I was very frightened. I walked into the hospital and the nursing staff was ready for me. There was a phenomenal team.
If I didn't have the resources that were here at the hospital, I really don't know how my life would have turned out.
Women are a little bit different. We have different stressors in our life that certainly impact our health.
We're caretakers. We take care of our husbands. We take care of our children.
Historically, women always put themselves last. It was always somebody else's needs that got put ahead.
Even if we're in pain, we just grin and bear it and are silent.
As a gender, we try to do it all.
Some of the psychiatric disorders impact women greater than men.
Colorectal cancer is the third leading cause of cancer-related deaths in women, yet screening lags behind that of breast and cervical cancer.
Women need to know that their health care is a priority.
Because as the linchpin of their families, if they're healthy, they can help their families be healthy.
The Northwell LIJ health system has made a substantial commitment to women's health, formally announcing the Katz Institute for Women's Health, where women in every decade of her life can get state-of-the-art care.
When I first heard that the Katz Institute for Women's Health is being developed, I thought that was the most exciting thing ever.
Katz Institute we think of as a way of harnessing the strengths of the Northwell LIJ health system, whether it be in clinical practice or in research and education, and then aligning them, creating new opportunities for women in our community to come to us to maintain wellness.
The Katz Institute for Women's Health is developed by the health system to acknowledge the fact that women require a different approach to medical care.
The HEART program is a great example of what a new program in the Katz Institute looks like.
In medical school, heart disease was a man's disease.
When women got chest pain, doctors would tell them it's all in their heads.
It was my grandson's bar mitzvah. I had an incredible pain in the center of my chest. I just had one thing in mind. I had to get in that car and drive to North Shore LIJ.
Joyce drove herself in a gown. She looked for all intents and purposes as if she were having a heart attack.
The blood work that came back did not indicate typical heart attack.
We realized that she had something we call the broken heart syndrome.
It's reversible, some medication. I was back to normal. I'm out there enjoying life and I have no broken heart.
I had my heart attack one day after my 59th birthday. I remember the feeling of isolation. If I can help another woman on that journey, then that's what I'm supposed to do.
Our health system has made a large investment in women's services at virtually all of our hospitals.
Erin had complications during her pregnancies. They weren't just normal pregnancies.
Dr. Sassoon is an incredible doctor. In my first pregnancy, I had a rupture with a placenta previa.
She was approximately about 24 weeks pregnant and started bleeding. And we rushed her to the hospital.
Within minutes, Dr. Sassoon walked in, figured out exactly what was going on with me, how to stabilize me, and just so grateful that we have the outcome that we have today.
I think any woman who hears the diagnosis of ovarian cancer immediately goes into a panic mode.
I had symptoms of bladder infection and it just kept recurring. My gynecologist came to find out that I had two 12-centimeter tumors.
When I met Melissa, she was obviously scared about what the diagnosis could mean for her.
Dr. White immediately said, number one, I am not a statistic.
We've seen a real evolution in the way that we manage women's cancers. It's really made a difference as far as women being able to survive their disease.
Today I feel gratitude for the people who helped save my life. I call them my angels.
Melissa is a fighter. We walked together in the ovarian cancer awareness walk, and it's just a really special thing to know that it is more about helping our patients not only beat cancer, but get back to their lives.
I'm so blessed that I work in a place that understands how important it is to take care of women.
Women have to look at ourselves as a sisterhood.
Treating women has been a calling for me.
I have such unbelievable respect for the doctors at North Shore, how much they involve themselves, not only in just dispensing medicine to people, but in really sitting down with you and trying to understand how you're feeling.
Just the care that I've received and that I've seen other people receive is impeccable.
It feels wonderful to be taken care of by such amazing people.
Philanthropy is a critical component to our ability to continue to grow and provide the varied needs of our community.
Having donors is so important to be able to have continuing resources for people who need them.
We need people to help us to be as great as we can be.
Support is everything. You can't make progress, you can't move forward without support.
Without philanthropy, we would not have an Institute for Women's Health.
The Institute really speaks to how North Shore LIJ is a leader in innovation and responds to their community.
This is going to be something that is going to change the way that women feel about themselves.
To have people who are generous enough to give their resources to build these facilities for women is remarkable.
Being able to do something for the community at large that is so impactful to the people who live here. There's nothing better that you can do with your effort, your time.
To be able to help another woman is the most wonderful gift in the world.